Hello and welcome to Wellness Watch, a show that explores the nuances and the burden of illnesses and diseases on mankind and how we in India are dealing with it. How many times have you gasped while running up the stairs, wheezed while laughing hard, or have felt breathless with little dust in the air? And what if I tell you that these are the symptoms of bronchial asthma and not just fatigue or tiredness? Asthma, also called as bronchial asthma, is a disease that affects your lungs. It's a chronic, that is ongoing condition, and it does not go away and needs ongoing medical management. Today in Wellness Watch, we discuss asthma. I'm Preeti Kaur. Asthma is a chronic lung condition that causes breathing difficulties, affecting millions worldwide. It can be triggered by a variety of factors like allergens, pollution, exercise, and even stress. While it can be sometimes mild, asthma can also lead to severe attacks if not managed properly. Understanding the causes, symptoms, and proper management is crucial for living well with asthma. We get your detailed report.
Asthma, a chronic lung condition that narrows and inflames the airways, can turn something as simple as breathing into a daily challenge. The symptoms? Shortness of breath, chest tightness, persistent coughing, and wheezing, especially when exhaling. While some may only experience symptoms during physical activity or at night, others deal with them constantly. And when asthma flares up, it can interfere with work, school, sleep, and in severe cases, becoming life threatening. Triggers differ from person to person. Common culprits include dust, pollen, cold air, pollution, smoke, stress, certain foods, medications, and even acid reflux. The risk rises if asthma runs in your family or if you have other allergic conditions like eczema or hay fever. Being overweight, smoking, or frequent exposure to secondhand smoke and pollution further increases vulnerability. Doctors use tests like spirometry and peak flow to evaluate how well your lungs function. Chest x rays and allergy tests can help pinpoint specific causes. If needed, advanced tests like the methacholine challenge confirms the diagnosis. Asthma can't be cured, but it can be controlled. Treatment focuses on reducing inflammation, avoiding triggers, and responding quickly when symptoms arise. Long term control medications help manage the condition, while quick relief inhalers offer fast breathing support during an attack. Lifestyle changes also make a difference. Maintaining clean indoor air, avoiding known triggers, staying active while being cautious, and managing stress also helps in reducing flare ups. From getting vaccinated against the flu to following a personalized asthma action plan, staying informed is your best defense. With the right treatment and guidance, asthma doesn't have to limit life. Millions are living fully, breathing freely, and proving that asthma may restrict your breath, but it does not have to restrict your future. Harshita Oberoi, reporting for Wellness Watch DD India.
More than 250 million people worldwide are living with asthma, a significant global health burden. This year's World Asthma Day theme is Make Inhaled Treatments Accessible for All, and it reinforces the urgency of ensuring universal access to affordable, quality-assured asthma medicines. Asthma can be life-threatening if you don't get treatment. Today in Wellness Watch, we find the following answers. What is an asthma attack? What triggers asthma? What are the types and stages of asthma? What complications can arise? And we also discuss the medical advancements available in India. Asthma treatment in India primarily involves using inhaled medications to manage symptoms and prevent attacks. Now, this includes quick relief inhalers for immediate relief and long-term control medications like inhaled corticosteroids to reduce airway inflammation, and also in some cases, allergy medications or advanced treatments like bronchial thermoplasty may also be considered. Up on your screens, we'll get to the institutes and hospitals in the country that specifically deal with asthma. All India Institute of Medical Sciences, Delhi; King Edward Memorial Hospital, Mumbai; Government Kilpauk Medical College, Chennai; Medical College, Kolkata; National Institute of Tuberculosis and Respiratory Diseases, New Delhi. To talk more about asthma and to help us understand it better, we're joined in by guests in the studio this afternoon. We're joined in by Dr. Karan Madan, Professor, Department of Pulmonary, Critical Care and Sleep Medicine, AIIMS, New Delhi. And we're also joined in by Dr. Rohit Kumar, Associate Professor and Head, Department of Pulmonary Medicine, Critical Care Medicine and Sleep Disorders, Safdarjung Hospital. I welcome both of you to Wellness Watch this afternoon. To begin with, Dr. Madan, I would want you to explain to our viewers what is an asthma attack.
See, first of all, it's very important to understand how do you identify asthma, and then you can identify an asthma attack. So asthma essentially, you see, it's primarily something which you'll encounter in younger ages or younger adults, but it's not incorrect to say that even older people can get asthma and they have persistent asthma. Asthma, as you showed, is characterized by somebody who has that history of cough, which is mostly seasonal, symptoms that come on during change of season, change of weather. They get chest tightness, they get wheezy, they have that whistling sound, which is very characteristic for us to diagnose asthma. That when a young child or a young person walks into your clinic and tells that I get this whistling sound, I get breathless, I get this cough, which is disabling, and this fluctuates. I mean, this is changed. So this is a kind of a clinical diagnosis. Talking to the patient and just speaking to them is mostly enough to diagnose asthma, though some tests can be done to, corroborate it. Now, if you have that background, and on top of that, somebody gets a severe, increase in the symptoms. Somebody gets very, very breathless, cannot walk, cannot, speak even complete sentences. The cough becomes very troubling, and the wheezing and the chest tightness becomes too bad. That is actually called as an asthma exacerbation, or in layman terms, if we call it, it's called as an asthma attack. So an asthma attack is once on a background of somebody who has ongoing asthma, there is a sudden increase in symptoms, and this can also actually be sometimes life-threatening.
All right, this can be life-threatening. I'll take that forward to Dr. Kumar. Dr. Kumar, how does one know that he is suffering from asthma? How do you differentiate between a seasonal cough to what Sir has explained?
So, as Dr. Karan has already elaborated on it, there are a lot of symptoms, and the presence of the symptom complex makes it very easy for us as clinicians to clinically diagnose asthma in most of the cases. The fact that the person is having cough, yes, but you'll often find wheezing. So there's something known as a cough variant asthma, where cough is the predominant symptom, but usually wheezing is also a very common symptom that comes across. And the other thing, that she pointed out was the variability of the symptoms. The person can have symptoms throughout the day, but often you'll find patients will have symptoms which are, off and on. And this variability could be over days, it could be over weeks, it could be over months. So this history that we get from the patient actually tells us a lot that this patient is likely to be having asthma.
All right, Dr. Madan, what triggers asthma in a person?
Yeah, this is very, very important to understand. So, the triggers, there are multiple triggers, and triggers can be different for different individuals. So if we talk about something, asthma is peculiarly seasonal in many cases. So, in our North Indian setting, we would usually encounter this happening during change of season like March, April, or something like November, October. So certain things change. The weather changes sometimes the cold weather when it sets in. The cold weather can also trigger something called as a reaction of, constriction of our airways, which is, we call our bronchi or airways constrict. That leads to that whistling sound because air is not able to travel in. So the triggers can be pollen, the season changes, some sort of pollen, or you see the trees shed off some kind of, the pollen, and that can also be a trigger. Other thing is sometimes the trigger can be, within an individual. So it can be sometimes stress can, trigger it. Smoking is a very, very important trigger for asthma. It can actually lead to somebody becoming asthmatic, or if there are children and, a parent is smoking or somebody in the family is smoking, or there is even a smoke exposure which is not direct, that can also trigger asthma in many individuals. There can be a drug-triggered asthma. Sometimes, some people, they have a history that we took something like an aspirin or some peculiar drugs like non-steroidal anti-inflammatory painkiller drugs. They can also trigger asthma attack in some people. And if you talk about young children and athletes, they have something which is called as exercise-induced asthma. They would usually be okay if they are not exercising, but as the person starts running or the athlete does vigorous exercise, they can get the wheezing symptoms. So the triggers are varied. Mostly they have change of season, pollen, smoking, and in some individual exercise, drugs if somebody is taking. So it's a pretty big gamut of things.
All right, Dr. Kumar, are there really any types of asthmas, or a step forward, what are the stages of asthma?
So we'll come to the types
Yes,
of asthma.
types and
There's something known as phenotyping that we do, in which we try to look at the clinical characteristics of the patient and then try to club these different asthma patients into separate groups. So you can have early onset asthma, late onset asthma. You can have obesity asthma with obesity and non-obese asthmas. This is one thing. Then there's something known as endotyping, in which we link the asthma with its mechanistic pathway. Now what that entails is we'll get there some blood tests done, and we'll try to find out what is it that is driving the inflammation of the airways. This could be eosinophilic, non-eosinophilic, it could be neutrophilic. And then what are the triggers, which Sir already talked about. So if the patient's having a lot of, recurrent exacerbations, then those frequent exacerbations or the severe asthma is also a type of asthma. Coming to the stages that you talked about, we see, say asthma is well controlled or not controlled. And once it's not controlled, what is it? Difficult to treat, or is it severe asthma? And then based on the phenotyping and endotyping that I talked about, we can decide on what are the therapies that we offer to these patients.
All right, Dr. Madan, is it a particular time of a day when asthma can be at its worst? Is it that during night the asthma attack or asthma patient feels the worst?
Yeah, so I think there is something called as a diurnal variation, means change during the day, that the symptoms may wax or wane. Yes, most of the patients do tell that, during night time their symptoms tend to be worse, or during early morning. But some people have something called as a persistent symptoms, in which, the symptoms are pretty much the same, throughout the course of the day. So as, Dr. Rohit also mentioned a term called as severe asthma, it's important to understand that most of the people, get controlled with the asthma treatments which we have, which are mostly inhaled treatments. But there are a certain group of patients in whom the symptoms just don't get controlled with the maximum inhaled medication. Those are a group of patients which, we call as severe asthmatics, and they require treatments which, are a step beyond the inhaled treatments.
You explained to us asthma triggers. Now, these triggers are something with which we live almost every day, and which is very difficult to, part ways within our daily day-to-day lives. So how can asthma triggers be controlled? Can they?
Yes. So I think there is definitely an option to, control your triggers of asthma. This can be in multiple ways, but first and foremost, one has to understand that the backbone of controlling asthma is giving treatment properly and well. So you give inhaled treatment. Inhaled treatment is the backbone of asthma. You don't have to be hesitant of it. It does not cause any addiction. It does not make you dependent on it. It makes you feel okay. Now, even if you are taking treatment well, triggers can worsen asthma. So then how do you take care of those triggers? So in case, if you have a known trigger, like you have a trigger like smoke exposure, so avoid smoking. If there is a second-hand smoke exposure, ask somebody who's smoking around to, get yourself away from it. If you know that, you tend to get wheezy during the pollen season, during the change of season, try to avoid outdoor exposure when the lot of pollen is in the air. Try to spend more time indoors during that particular season. If you are an athlete, you get exercise-induced asthma. Taking a few puffs of inhaler before you go to exercise can actually help you, and help you to exercise better and control that trigger. And if you've had and obesity, it's a very, very important thing, especially in female patients who tend to be overweight. It's a pretty difficult phenotype of asthma to treat. They tend to require more inhaled medications, more drugs, tend to get more asthma attacks. So in them, weight reduction, having a diet control, and the general aspects of a healthy lifestyle, keeping yourself physically fit and weight in control, can go a long way in keeping your asthma under control.
Dr. Kumar, is asthma a lifelong condition?
It is a disease that can be controlled but not completely cured. It is a chronic condition, often lifelong. But what the message that should go out is that patients should not be fearing this condition. If it is treated well, they lead a normal life. You'll hear about athletes and mountaineers who've had asthma. That never stopped them from leading their lives or living their dreams. So the message is, I mean, even if we cannot cure it, we can definitely control it. And patients should not shy away from their disease.
Dr. Madan, how is asthma diagnosed?
By clinical diagnosis, I mean, if you speak to the patient and you just hear out their story, it speaks the diagnosis. So if you have somebody who coughs, who gets wheezy, gets breathless, and those symptoms are waxing and waning. They come, they go. There's a seasonal tendency. And the onset, especially if it is during younger ages, that is a very strong pointer towards asthma. So I think other tests like X-rays are done to rule out other conditions. I mean, if somebody has something else. And the test called spirometry, that means you blow out into a machine. It tells how much flow you are generating. And asthmatics tend to have reduced flows. I mean, they are not able to blow out the air as well. That can strongly support your diagnosis of asthma. But I think that one has to understand that's not the only way to diagnose asthma. If you get some problem in your test, it can support strongly the diagnosis. But even many patients with asthma tend to have normal lung function. That's also important.
All right. Dr. Kumar, what is the 4x4 rule of asthma?
So there are multiple, I wouldn't go by the 4x4 rule if you ask me. My thing is, as Sir said, if you have to diagnose, the clinical diagnosis is very good. Spirometry adds to it. There are other tools that we seldom use in clinical practice. It's only in the difficult cases where we caught up that we actually use this. And with regards to treatment, the inhaled therapy is the best.
Okay.
So that would be it.
All right. Dr. Madan, what is the status of asthma in children? In today's times, as you told us that, athletics and children, athletes and children are more prone to asthma. What is the status of children getting asthma these days? Is it on the rise?
Okay, so I think children are a group of individuals in whom asthma tends to affect the most. I would say the childhood onset of asthma happens, and usually it's not a very, very small child. Usually, once the child reaches like 3, 4, 5, these are the ages at which asthma usually sets in. And I think that is very important to understand that asthma is pretty common in them. Now, if you do good control of asthma, if the child gets asthma, it would help, in the child getting a good lung function and leading a more productive life throughout adulthood and through old age. If your asthma as a child is not treated well, some people can actually tend to, you talk about stages of asthma. Some people in which asthma stays uncontrolled for a very long time can go on to develop something called as a remodeled asthma. By remodeling, we mean that your airways, which initially were reversible, they can open up and close, they tend to get fixed obstruction. That obstruction does not tend to get better with, inhalers. So I think bottom line is children are a very, very important population to get asthma. Persistent cough in a young child, which is seasonal, associated with wheezing, will more likely and not be asthma. You tend to, evaluate children. And inhaled therapy also remains the backbone of management of asthma in children also. So that one should understand.
Dr. Kumar, what are the medical advancements in this field?
So a lot has happened over the years with regards to diagnosis as well as treatment. With regards to diagnosis, we've been using spirometry for many years, but now we have other tests which help us get the idea of what is causing this inflammation. If it's eosinophilic, we can do a pheno test, which will tell us about high, exhaled nitric oxide levels. The other thing that we come across is with regards to treatment. Earlier we were using inhaled therapy, and once we ran out of inhaled therapy, we were using systemic steroids. Now, steroids, as good as they come with a lot of side effects. To prevent these side effects, we have something known as biological therapy, which is akin to a targeted therapy. So, you just hit the molecule which is driving the inflammation, and once you do that, the inflammation comes down and the patient can lead a very normal life. So these biological molecules are, I guess, the new game changers that have come in and that have made our asthma management plan very
efficient and effective. So would you add to it?
Regarding inhalers, remember one more thing, that it's not that you need to take your inhaler only once you have symptoms of asthma.
All right. So that has to be
Yes. So it is a continued therapy. I mean, if you start treatment, it's to be given over sometimes because, the airway inflammation and the problem tends to stick on even if you are feeling okay. So you need to treat it well.
Right.
And it's not, and the common mistake people do is they stop taking inhaler once they start feeling better. And also the other one important thing is inhaler technique. Inhaler does not mean that, you will just put it in the mouth and it will automatically be done. teaching a proper technique is very important. I have seen patients whom the doctor hasn't told them how to take the inhaler, and instead of taking the inhaler, they are spraying the inhaler. So that is one more thing. But I think the bottom line is technique also has to be learned. There are videos, everything data, literature is available. You can see a simple video and learn how to use.
Right. So right time of the treatment and consistency of the treatment is important in dealing with asthma. For our viewers who've just joined in, we are today discussing asthma in Wellness Watch. We're joined in by Dr. Karan Madan, Professor, Department of Pulmonary, Critical Care and Sleep Medicine, AIIMS. And we're also joined in by Dr. Rohit Kumar, Associate Professor and Head, Department of Pulmonary Medicine, Critical Care and Sleep Disorders, Safdarjung Hospital. Both of them helped us understand asthma better. And now for the benefit of our viewers, doctors, we'll have a quick rapid fire round, a kind of a myth buster round. And I would request you, both of you, to give very brief, short, crisp answers. Dr. Madan, asthma is a childhood condition and people can outgrow it. Is it so?
Yeah, yes.
Dr. Rohit, asthma medications are habit forming.
No, not at all. Not at all. They're very safe.
Asthma patients should avoid exercise. Should
No.
they, Dr. Madan?
No, I think they should lead an absolutely normal life. That's the goal of treatment.
Nebulizers are better than inhalers. Are they, Dr. Rohit?
So if they can use their inhalers well, nebulizers are as good. They're not better.
Dr. Madan, asthma is not a life-threatening disease.
Now, asthma can be a life-threatening disease if one gets a severe asthma attack. Yeah, so that's why inhalers should be used regularly.
And Dr. Kumar, asthma treatment is only important and necessary when symptoms actually appear.
Oh, not at all. In fact, the medications that we give, they reduce the inflammation of the airway and prevent the symptoms from appearing. So taking it on a regular basis is actually a better way.
All right. With that, we end this discussion here. Thank you so much, both of you, for joining us on Wellness Watch and helping us understand asthma better. So after the discussion with the doctors, we did understand that asthma, in fact, is a chronic condition, but it is manageable with the right approach and proper medical care, and also a commitment to healthy lifestyle practices. If you or a loved one is struggling with asthma, don't wait. Seek expert guidance and care, and with proper treatment and lifestyle modifications, people with asthma can lead active and healthy lives. Remember, you will never know just how much you value your breath unless one day you stop breathing. With that, we end this edition of Wellness Watch. Thanks for watching. Bye-bye.
Recording?